Hello, everybody, and welcome to this last masterclass series of three masterclasses. And today we have Dr. Federico Rivara from beautiful Italy. I'm really looking forward for this presentation. Before I give the word to Federico, I would like to introduce myself quickly. I'm Holger Kast. I'm the head of training education at TRI Dental Implants. I'm leading through this webinar. You know the rules. There we have at the end the chance to answer your questions. Please write your questions in the question field. I will moderate them at the end of the presentation. Today's topic, or the masterclass, the series which we did with three different speakers, is about this scan and smile in 15 minutes. We will explain in this presentation how is that possible with the matrix implant and an AI crown design, and 3D printing possibilities to immediate print temporaries. That's what we talk about. We are TRI. TRI is known as the #1 digital implant company. Yeah, this is because we changed the interface of the implant towards digital CAD/CAM technologies, and this is the matrix implants. The matrix implants includes more than 8 patents. It's created for 3D, no, for milling first. At first for milling, and in the our days, the technology went so fast towards 3D printing. So this connection allows you to eliminate any need of any abutment. So we can screw retain a 3D printed crown, or also a fully zirconia crown milled in a CAD/CAM milling machine from your dental technician into this inner connection. And this is quickly just shown this implant because I know that Federico will explain the implant as well a little bit. And so this is a multi-level implant. You can see that concave design allows you to place the implant in different heights. And the magic of the matrix is really in this inner connection. You can see here a very wide disc, let's say, with a 20 degrees conical inner connection, very smooth forms inside, so zirconia can really easily sit in there. We screw retain our prosthetic with 35 newtons into the implant, and that allows us to do what we are doing. We have this implant in the market now in the 6th year. We started this series, this implant journey with the matrix implants with very known people. Very included is Professor Ronny Jung from the University in Zurich with his whole team, and other doctors. And we are really happy about our 5-year special edition of the case book. So we document our cases, and I just want to show you quickly how implant system without an abutment, and also the elimination of any cementation, we don't need tie bases, how this is biologically improving your tissue situation and the bone situation. Just look at the 2-month and then to the 5-year follow-ups of this beautiful aesthetic case from my friend Dr. Joel Tellers from Portugal. You can share a QR code at the end. You can download this special case book. At the end of my presentation, I will share anyways more QR codes which are interesting for you. We can do that with single crowns, but we can do it also with full arches. And this is the very first fully digital created full arch with Ivan Pev. This is also really fantastic to see how the bone stays stable with an abutment-free and cement-free implant system. So now talking about this scan and smile in 15 minutes, how is it possible to place an implant and then have a temporary crown or a healing color done in 15 minutes? I think I don't go to the details because Federico will explain you that much more detailed. It's just like crazy that we can do that in our days in 15 minutes, placing an implant, scanning, then an AI crown-based design software creates you a crown or a healing color. And then on the our days 3D printers, we can print up to 10 minutes, 5 to 10 minutes. We can print a temporary crown. And I'm quite sure in the future we are ready to print even final crowns because the materials of 3D printings get better and better every day. And now I would love to welcome you, Federico. Rivara from Italy. It's really nice and a pleasure to have you. Please introduce yourself and start sharing your screen, and I'm looking forward for a great presentation.
Hi, Olger. Thank you very much. And welcome to all the friends that are connecting right now in the webinar. A lot of people are connecting. Very, very happy that you find the time today during a working time to connect with us. Let me share my screen.
Yes, it's starting already.
You will be there for the webinar. So maybe if some people want to ask something more technical related to the company, you can answer. So Olger will be with us for the next 45 minutes. And talking about me, I don't like to introduce myself too much because we don't want to bother you with CVs or something like this. But the most important thing is that I work in my practice that is placed in Mantova. Is a small town in the north of Italy, in between Verona and Bologna, that are the more important cities than Mantova. But it's a very scenic city. If you want to come to my practice to see something, to discuss cases, or to do courses, please ask because we are ready, and it can be worthy. About my everyday work, I spend my week in Mantova in my private practice, and a couple of days during the week I move to Parma, that is close to Mantova, working in the university when I work with TRI as well. When we are running very interesting a research project that can put together all that new stuff that we have on the market in these days, talking about implants, but talking about bone regeneration as well. So we are working together with Geistlich and TRI to create the next step in bone regeneration and implant placement in regenerated bone. So stay tuned because we are coming out with new stuff in terms of data and in terms of material and everything that we can add in our clinical practice. As you can see by my affiliation that you can see in the bottom of the screen, I work in university in my practice, but I am affiliated to scientific societies. And the scientific societies I work with are the Italian Academy of Osseointegration. So this is my first interest in the field. So implant dentistry. The second one is the Italian Academy of Aesthetic Dentistry. So I am very interested in aesthetic dentistry as well. And the third one is the Digital Dentistry Society. So in my practice, I try to put together everything, trying to treat my patient with success, not demanding parts of the treatments to other colleagues, but I try to treat my patient with from the diagnosis to the perio part, the implant placement, bone and soft tissue regeneration, and at the end, the temporary and the final restoration. So I do the prosthetic part by myself when I can in my practice with a chair-side approach, as I am trying to talk to you this day in the webinar, and with a special eye on the digital part of the treatment, because I'm very passionate, if we can say like this, I'm passionate about digital dentistry. Holger did a brief introduction about the implant, but let me introduce again the metrics, because if we can realize this type of new stuff, this type of new approach in terms of implant placement and crown delivery, is because we have the right implant. Matrix is defined from the company as the first digital implant. Why is a digital implant? Because if we don't have to deal with an abutment, we can go directly from the design to the delivery of the crown without the lab work that we have to deal with usually when we work on normal implants. And we are going to see this difference between traditional implant dentistry and the new digital implant dentistry. One of the features that makes the Matrix a peculiar implant is the neck. We have a concave, smooth pink color. Maybe we can discuss at the end with Olga a little bit about the surface. I don't want to go too deep inside of the surface considerations because this is not the topic of the webinar. We don't have too much time. But this color is not a machine color, has a certain grade of roughness. So this type of implant can be placed in different levels. For this reason, we define this as a multi-level implant. Just to be sure to be all at the same page of the book, I want to define the vertical 3D position of an implant, because usually we deal with bone level implants, and we have to put a bone level implants at the bone crest, at the bone level, if we have an internal hexagon or an external hexagon connection, or maybe we can push it a little bit subcrestally if we have to deal with reduced height of soft tissues. But we can do this only if we have a stable conical connection. Otherwise, we can use a tissue level implant. So something that we allows us not to go inside of the bone level with the machine part of the implant, but we have to position the smooth part, the machine part of the collar in between the bone level and the tissue level. So we try to introduce something different, because with this specific type of shape of the collar, with the concave shape, we can place the implant at the tissue level. So positioning the prosthetic platform in between the bone and the soft tissue height, depending on how much tissue we have, maybe to deal with the emergence profile of the crown, or maybe we can push a little bit the implant, a little bit subcrestally, not completely subcrestally. We have to stop at a certain level because we don't want to push with the connection inside of the bone crest. But this is a nice graphic that represents the bone level, the bone crest as flat. But most of the time we don't have a flat crest. So sometimes just to have the collar in the right position on the buccal side, maybe we are a little bit inside of the lingual side of the bone crest. So if we have an implant that allows us to be positioned of a multi-level, we can deal with more or less all the clinical situation, all the clinical scenarios that we have to deal with. So this is the multi-level approach. The second feature is the connection, as Olga introduced before. So we go direct with the crown on the implant head. We don't have a tie base. We don't have to cement the tie base on the crown. We don't need for the lab, or we don't need the lab for the temporary. Sometimes we need it for the final, but or maybe for the refinement of the crown on the or maybe to change the shade of the crown or to refine at the end. But if you have a solid chair side process in your practice, you can do the complete workflow by yourself. For sure, it's time saving and is also money saving, because we reduce a part that you don't have to use the tie base that you have to pay for this. This is the difference between a traditional implant system and the matrix implant system. With the traditional one, we need the crown that have to be cemented or glued on the tie base, and then the new component, tie base and the crown, all together, we have to screw it on the implant head. With the matrix, we need only a prosthetic screw. The prosthetic screw is a 2.8 diameter screw, long or normal. It doesn't matter. It depends on the design of the crown. But this is specifically type of prosthetic screw, together with this type of connection and the type of internal conical part of the implant, allows us to connect directly the temporary crown made by resin or the final crown made by a certain type of zirconia directly on the implant. For sure, most of you that are used to use mainly the traditional type of implant are thinking if we can rely on the zirconia that is directly connected to the implant. We are starting having literature about that. Researchers are doing a lot of stress tests on zirconia, and we have this similar number of failures comparing to the traditional implant system. But the most important thing to underline here is that we don't need to have the cement at the position when with the cement when we don't want to have the cement. So at the position of the connection inside of the soft tissues, just imagine to treat perio patient or patient where we augmented the bone or maybe the soft tissue. So we want to see the image that you can see here with the green flag. So the matrix image, so with the implant head and the zirconia, maybe a polished zirconia in that position, compared with the groups with the cement. Because what we are not used to see is the situation that we have after years of loading. Look at this image. This is my case, a case of mine. So this is not something that I found on the internet or something that I didn't have the control. I controlled this zirconia crown that at the moment of the delivery was cemented by the technician on the tie base. And when I decided to remove the crown from the tie base, I experienced this. So the thin layer of the cement between the tie base and the zirconia was destroyed. So this is the interface that we have to deal with inside of the soft tissues after years of loading. Maybe not all the time, for sure, but sometimes we have to deal with this. So we want to reduce the risk to have infections or to have problems, or maybe to have fistulas or something like this with problems on, especially in perio patients, as I told you, or maybe when we have to deal with a certain high of mucosal tunnels. So this is the workflow. We have to place the implant. We can scan the implant immediately after the implant insertion. We can start thinking in a new way with the AI design software. Then we can produce our crown no matter of which type of printer do you have. My advice is to have an high performance dental printer with specific resins. I use a resin with more or less 50% of ceramic inside. You can push with a certain type of printer like the Midas from Sprintray up to 70% of ceramic particles inside of the resin. But no matter what, you can print and refine the crown chair side in your practice, and in more or less 15 minutes you can deliver the restoration. Today we want to push a little bit more on the AI design service. This is the Scan and Smile. This is a trademark from the company, the Scan and Smile system, that, as you can see here, enables clinicians to deliver provisional restoration directly on implants. So you can do all the process by yourself. Because when you discuss with your technician about placing an implant and scanning at the same time, the point is you need someone with skills and with the CAD software that designed the crown for you. And you have to receive back the STL file. Sometimes you are not happy with the design, because this is something that we experiment every day. This is my experience. I have great technicians, but sometimes I ask them to design something and the design is not my ideal design. So I ask them to modify it, waiting for 20 minutes more, and I receive another STL file. I have to check it, and maybe I have to go to the production phase. With AI design, in seconds, not in minutes, in seconds, you can design the crown by yourself on the same computer you did the scan 1 minute before. So I want to show you, we are here to see cases because we want to, analyze the experience that we have. Maybe we can ask me something about the cases at the end of the presentation. We are going to have 10 minutes, more or less 15 minutes of Q&A. If you want to take advantage of this, we can discuss about cases. I want to start from a case that every day we can find in our practice. A patient with a single crown that cracked, that have a fracture. So we want to go for an immediate loading. This is a case of lower canine. The patient arrives in this situation and we want to solve the case for the patient immediately. So we decided to remove the crown and immediately freehand. For sure, this is an emergency, so we have to treat the patient immediately without the time to create a surgical guide. So this is a freehand implant. Look at the positioning of the implant head. Is a little bit subcrestally, mesial and distal, but is perfectly placed on the buccal side. Immediate implant placement, immediate management of the hard tissues with the collagenate, the BBM, just to treat the jumping distance. And this is the moment of the digital impression. In few seconds, we can go to the Dentbird Crown AI design software. This is a software that you don't have to have on your computer. You can connect on this platform online. This is on the cloud, so it's very easy. You can work from all the computer that you have with your intraoral scanner. And this is the workflow. You start uploading only two files, the lower and the upper jaw in occlusion. You have to ask him to analyze the implant. You select the implant type, the implant brand, the implant type, the screw that you are using. You have to identify, is a semi-automatic identification of the scan body. And look at this. In few seconds, we can generate a crown directly on the implant head. You can see the connection over there. And this is the crown. In a few clicks, you can modify according to your preferences, maybe to control the occlusion, to close the contact points, and even you can also adjust the emergence profile. Look at this, very easy. I'm not a dental technician, so I'm a dentist. I don't have skills for CAD design, but with this software, it's very easy to do slight modification and to change the shape of the crown. At the end of this, it took 3 minutes. We can export the STL. We don't need anything else. And this is the positioning, the nesting phase of the crown in my 3D printer. As you can see, the most important thing is not to have the supports touching the connection. The connection is that small half ring that we have on top of this and has to be printed by the 3D printer. Remember, we don't cement anything in the crown. We have to go directly with the 3D printed connection inside of the implant. So we have to pay attention to print this part in the best way. And look at this. This is my, I have a Sprint 8 Pro 2 printer. This is the crown. I prefer to add a little bit of glaze or maybe to change a little bit the color of the crown, not touching the first part. Look here, close to the connection. I prefer to polish the resin in that part, just to have a polished resin in contact with soft tissues in the most important and critical part of the implant. We try to insert the prosthetic screw here, and then we can deliver immediately the crown. This is the real immediacy, because we didn't ask the patient to come more times, more appointments to take impression, take photos, maybe ask the technician to create a walks-up or to prepare the patient. But we can ask the patient to stay in the practice. We remove the root, insert the implant, and then the crown immediately. And this is after the removal of the suture, a few weeks of healing, and now the patient is ready to receive the final zirconia restoration. As I told you at the beginning, I'm quite passionate about digital dentistry. So when I saw a digital implant, I was very happy. But for me, in my opinion, digital means planning. So if we have a digital implant, the second step is to create a proper digital planning, and digital planning means guided surgery. So for me, the ideal way to place this type of implant is to have a guided surgery for sure, so we can control digitally also the height and the vertical placement of the platform, because it's very sometimes it can be tough for us to see, maybe in cases of post-extraction sockets, to control the height and the positioning in vertical of the connections, especially when we have to deal with more or less 2 millimeter height of collar. So we have to deal with 0 point something in vertical. So I prefer to plan it. This is the TRX guided surgery kit with all the drills, all the stuff. On the right side of the screen, you can see the type of guides that you can ask. Is both sleeve or sleeveless system. In the sleeve, you have to connect metal sleeves after the printing of the guide. With the sleeveless system, you can avoid it. With the TRX, I prefer to go sleeveless. This is a particular type of sleeve because you have a double stop. You have a stop for the drill inside of the surgical guide, and a second stop on top of the surgical guide for the implant mount on the countersink. It's very nice system. For this reason, let me show you a case of single post-extraction socket with immediate loading using the guided of TRX. This is a female patient that came to my practice for a root resorption on the 1.2. And this is the design of the surgical guide. As you can see here, we don't need to cover all the teeth. We don't want to be too occlusive with the surgical guide. So we want to see what's happening below. We can open flaps like this. And this is our sleeveless system. So in sleeveless system, we need the part of the guide that supports the drill that has to be a little bit higher. This is the double stop. As you can see, the inner part is the stop for the drill, and the outer part is the stop for the mount. We are going to see this in detail later. And this is the drilling sequence. So we start from mucotome, just to be sure to remove all the remnants of the soft tissues all around the preparation on the more occlusal position. We start with the drills. We have different diameter from 3.3 to 3.75, 4.1, 4.5. It depending on the type of implant you want to place, and it depends on how much you want to under-prepare the site. The system is a little bit different from the other surgical kits that you have, because most of the time you have drills corresponding to the heights, 8 millimeter, 10 millimeters, 11, 13, and whatever. In this type of surgical kit is very simple, but you have S drill, M drill, L drill, or XL drill. And according to your planning, you have to stop to one or another drill. After the drilling phase, we place the implant. Look at the detail of the pin collar with the concave shape. Very nice. After the implant placement, we can connect immediately the scan body. One time more, we can go inside of the crown design software. In few seconds, we can design the single crown here. And this is the crown after the printing. Before the finishing, we have to wash it and to put it in the polymerization machine. And this is the final. After the refinement, as you can see here, how precise is nowadays the dental 3D printing. We can print without any effort this type of small connection with the index of with the anti-rotational index. Here we have to check if the screw pass in a passive way through the crown, and now we can go to the patient to deliver the immediate loading here, and the patient is very happy about the results. We can take a look to the video just to have a different view of the TRX system. For sure, it's very important to remove very gently the root. Look at the accuracy and the precision that the guide has sitting on the teeth. And this is the TRX system in action. Look at how is the accuracy, how accurate is the system. Look at the series of the drills from the mucotome to the right diameter and the right length to place the implant. I try to under prepare this the site. This is the 3.3 drill, and this is our motor implant mount, and we can check at the end the position of the pin collar. If we have a little bit of bone, we have a tool that can remove a little bit of bone remnants all around, just to be sure that we can see it before this tool, that is the scan body, and after the crown. So this is the immediate impression, and this is the final results at the control. So the patient is happy, the tissues are very, very stable, the bone is stable. We are waiting for the final restoration. Today, I don't want to discuss with you too much about the final phase, because we don't want to talk about milling machines or too much about zirconia. I have at the end a final case just to show a little bit the feature of the zirconia that you have to ask to your technicians. But the scan and smile system is something that related to the immediate restoration. So starting from the implant placement to the final, to the immediate temporary restoration with resin in more or less 15 minutes. So all the stuff that we want to do as a final in terms of impression, trying, type of zirconia, coloring of zirconia, shading, is something that you can do, but is not related with the scan and smile protocol. We are pushing more and more these days on the AI crown. So we started a few months ago only with a single crown. Now we can design bridges. We can design on implants, and we can design on natural teeth as well, because if you have to treat a section of your patient with implants and natural teeth at the same time, you can do it easily without effort. And in the future, we are developing also the AI crown for the full arch rehabilitation. So stay tuned, because this is a brand new technology. And as you know, the brand new technologies are evolving very quickly. So this is a multiple post-tax immediate loading with the TRX. In this case, I had to remove this bridge in the first quadrant with the two central incisors involved. I had to remove the crown, to remove the crowns, to remove the roots, and then this is one time more a 3D printed surgical guide. The drilling sequence, the matrix implant placement. We have the video as well. We remove the crown. We have to open the flap. So in these two implants was one post-extraction socket and one healed crest. Very easy. It's a very easy process. You can control everything here. And with the implant mount, you can control as well the height of the positioning of the pin collar. If you are not sure about the position of the pin collar, you can remove the guide, you can go freehand, and you can finalize the vertical position of your implant. In my opinion, it's always better to finalize the case with the full guided placement, because if you spend time to place properly something, it's better to finish with the surgical guide. We take the impression immediately, as I told you before, with the two scan bodies. And this is the design that we obtained from the crown design. So the implant supported bridge, between two implants and the natural teeth bridge at the same time. As I told you, we want to deliver the temporary restoration for the patient at the same moment of the surgery. So for me, with my printer, it's not a big deal to print one crown or 10 crowns. With 3D printing is the same, because printing layer by layer, you don't have to wait like in a milling machine for the milling machine to mill one tooth and one other and one other and one other. You don't have to wait for that time, so you can go on with all the crowns in the same moment. So we have the implant supported bridge. We can add also angle screw if we need. We print the natural teeth bridge, and now we have to deliver the crown. The crowns that we have to deliver here, a small bone reconstruction in the corresponding of the pontic sides, and then the delivery of the bridge with 3 crowns on implants and the 4 crowns on the natural abutments. Okay. Just to go a little bit towards the finish of the presentation, and just to letting 10 minutes for discussion, we have a few more cases. I tried not to do too much a case presentation. I want to show you the cases that have different one from the other, just to show to you the possibility that you have with this system, and not try not you to think that you can deliver only the single heel bridge, single implant with single crown, but you can push a little bit more. In a case like this, we have to deal also with a bone regeneration, because we have to remove these 2 crowns. We have to remove this root due to root resorption with an infection. So opening the flap is not only an implant that we have to use for sure with closed flaps, with immediate loading, no flaps. No, we can open flaps, not a big deal. We have to remove the apical lesion. We want to separate the soft tissues with the infected tissue and the bone. We have a small resorption of the crest. One time more, we want to go for guided surgery. And look at the details of this picture. We are inserted the implant. We are half position. We want to go with the pink color inside of the crest, leaving the space for the bone regeneration and the soft tissue at the same time. The detail of the position is very accurate. As you can see here, the internal specific patent, and Olger told us that we have a lot of patents on this implant. And one of these is the color and the connection. In case like this, we have to deal with bone regeneration as well. So I always use gaseous biomaterials. So the DBBM is the BIOS, the BioGuide in this case is a new type of BioGuide that is a little bit more strength. So we can manage it in a better way. I position a titanium tags when I can. If I cannot position a titanium tags, I want to stabilize the guide with a suture. But the point is, we can do everything in one surgical time, because we can go with our implant with the pink neck that comes a little bit outside of the crest, letting us not to work inside of the bone, but a little bit outside of the bone crest with the final with the temporary crown. The patient was asking for an immediate loading here, an immediate restoration. I agreed. So the impression, and in this case, we wanted to treat immediately at the same time the crown on the implant and the crown on the 1.1 on the natural one. So this is the design. Look at the specific design of this part of the crown. That this is the connection. I want to stress this one time more. You have to choose a high performance printer, because you don't have to print the temporary, but you have to print the connection. So this is the point. And this is the 2 crowns, the 2 temporary resin crowns connected, and we can let the soft and the hard tissues healing all around, creating the right anatomy on the two crown that can guide the healing here. So guided bone regeneration and guided soft tissue healing by the temporary. Not only aesthetic zone, we can treat also the lateral or the posterior ones. In this type of case, we had to deal with alveolar ridge preservation because I had to remove a root and I have to remove a single premolar. The bone was not ideal for an immediate implant placement, so I decided to regenerate the site with the DBBM with a polynucleotide gel. It's called RegenFest, and a collagen matrix called Mucograft. Altogether is the ideal environment to let the bone heal with the use of this specific viscoelastic gel together with the biomaterials. We can improve the bone regeneration in terms of quality and in terms of time. Because this type of substances are called bioactive agents, so that works together with the cells of the patients, improving the vitality of the cells and the overall effect of the bone regeneration. You can see after 5 months of healing, the bone is very stable. We cannot barely recognize the particles of the DBBM here. One time more, TRX system, our guide here. These are the two implants that I selected, a shorter one in the posterior part and a longer one in the premolar side. And look at this on the left side, you can see how the bone, the regenerated bone, is integrated with the native bone of the patient. And on the right side, you can see with your eyes how mature is the bone where we did the regeneration. Now is the time for us to drill for the osteotomies for the implants. Look at the strength that I had to put on my drills to enter the regenerated bone. Sorry. And now the two implants, what I want to show you in this case that I like is the position of the pink neck. And as I told you before, the pink neck is very nice to be used in perio patient, but also in regenerated bone. So we can displace the prosthetic connection away from the regenerated bone, letting the soft tissue creating a great soft tissue sealing, and to the crystal portion of the soft tissues can recreate the sealing all around the implant. This is the first phase of healing. And look at the final restoration. I decided not to go for temporary ones. I decided to go directly for a final zirconia restoration. Look at this image. This is one time more the connection that has to go inside of the implant head has to be milled. In the cases that you saw before, we had to print the connection. Now we have to mill the connection. So for the same reason, I ask you to use a high level printer. In this case, I ask you to decide to work with a high level dental lab, because the dental lab has to be certified by TRI. It's not something expensive because it's a free process, but TRI wants to be sure that your lab can treat the zirconia in the ideal way to host the prosthetic screw and not having problems in the future like fracture or something like this. So you have to mill the connection. In the light green here you can see that small part of the connection that has to deal with the internal hex of the implant, the internal connection. In the pink you can see here the notch that the connection uses not to rotate, so is the anti-rotational index, and the blue line here defines where the technician decide to stop to put ceramic or glaze or something else, because we want to have polished zirconia on the first more or less 2 millimeters to ensure the hemidesmosomes of the soft tissues to create the best adhesion here to have a stable situation in the future. So 3 parts you have to take care of: the milled implant connection, the milled index, and the polished zirconia. So no stain, no glaze, no ceramic in that part. And this is the final one. As you can see, the situation of the soft tissues is very stable. The zirconia is perfect, and we are very happy with the final as well. The last topic I want to discuss with you today, last couple of minutes, is this. If we don't want to go for an immediate crown for the patient, maybe in the posterior ones, we have to deal with the pin collar that comes a little bit outside of the bone crest, and we have to decide the type of temporary that we have to put on that. For sure, we, as you can see in one of the picture, in one of the videos, we can deliver a normal metal healing abutment. Is not a big deal. But the point is, if with this type of technology, we can individualize the crown with the CAD system, chair side, at the same way we can individualize the healing. So we can design individualized, customized healing abutment with the AI crown in the same way we design a single crown. So in cases like this, I'm increasing the number of rehabilitation like this. We have a well-defined septum. We can remove the tooth without infections, without perio problem. This case was a fracture, a vertical fracture of the molar. So we have to be gentle to remove everything without destroying the soft tissue and the hard tissues. We can position our matrix inside at the center of the septum, and then we can complete all the regeneration all around. In this case, always with the polynucleotides gel together with bovine bone with the collagen part that is a bios collagen together with the region fest inside of this socket. We have to maintain all the connection without bone peaks or bone particles, because we have to guarantee the perfect seating of the scan body. And after the scan, we go direct one time more in the AI crown design, and this is what we can design in seconds. You can ask the AI crown design to design a crown, and with the tools you can lower outside of the occlusion, or maybe you can decide how much you want to come out from the soft tissues. You can design as well the inner part. So if the implant is a little bit deeper and maybe you have to deal with the bone, you can design a straight emergence, and then you can open, or maybe you can start maybe with a bowl shape from the implant head. And this is the delivery of this type of healing collar. So we are start here, from here to guide the healing of the soft and hard tissues, and after 3 months or less, maybe we can remove this one. We will have the perfect emergence profile without the shrinkage of the tissues on the buccal side, and easily our technician or our milling machine can create the perfect emergence profile of the crown, and the case is finished only with one surgery without pain for the patient and with the ideal result. Guys, I have finished my presentation. I would like to thank you for the kind attention for the last 45 minutes. This QR code is my personal Instagram account. Most of the time is a professional account. So you can see here a few of my cases, my conferences, my courses. So all the stuff that I do with TRI, Geistlich, Sprint Tray, and I try to push on digital dentistry every day. Thank you very much. And Holger, if we have some questions, we can answer.
Yes. Oh my God. Thank you so much for this presentation. It was a pleasure to listen to you and watch you. Amazing documentaries, amazing pictures. I think everybody in this webinar learned a lot, and it's what we're doing, the passion for digital workflows. And you really gave an amazing presentation here. And yes, we have quite some questions, and it's great. We have still 10 minutes time, so you can still add your questions in the question field. Let me start with the first question to you, to moderate the first question to you, because then I will share my screen. And at the end, just like of this question session, I will share again my screen to share with you also the link to this AI crown software where Federico was talking about, so you can start your own account and some other upcoming courses and events I want to share with you. But now let's start with some questions. How deep can we go subcrestal with the matrix implants? I think that was a question very at the beginning already when you showed this slide and you showed there, and maybe you can explain a little bit this tool with when in the time I share my screen here.
Yeah, the idea is you can push the pink part inside of the crest. It's not a big deal if you want to go a little bit deeper, but you have to take in mind that you will not have a tie base to come outside of the bone. So sometimes with a normal, we can call traditional implant system, you push your implant inside of the bone crest. And if you want to be sure that you can see the crown, you have to ask your technician to put 2 millimeter, 3 millimeter, or something like this, or maybe to use an intermediate abutment to come out from the bone, just not to have the crown, the ceramic that pushes on the bone crest. In this case, you have to be sure to leave the more coronal part of the implant outside of the crest, maybe 0 point something, but you don't need to have too much of the implant outside of the bone, but you have to be very, very safe not to have bone particles or something that can push against the scan body or maybe the crown, because otherwise you cannot see the crown.
Yeah.
And this is a problem, because sometimes you can insert the implant, maybe you cannot you don't realize this because you put the normal healing abutment that is very narrow, the normal healing abutment. You have the bone all around. After a few months, you take the impression. You can take the impression because the scan body is narrow, but when you try to put the crown that has a certain shape, you touches the bone. Maybe just not think. We don't have to think about a flat crest, but maybe in the single crown you have the bony peaks of the mesial and distal. So you have to take care of this. TRI provides a tool that is very nice that you have an image, Holger, of the.
Yeah, but I think we don't it's too much to share that now. But it's a really
Okay.
nice tool. We have a cylinder which you can screw retain in the placed implant in the thread of the implant, and it's looking out a small cylinder, and over that cylinder we come with a bone profile platform drill which cut either the platform 3.7 or platform 4.5. There's two different drills. We cut the sides of the bone to give you the space for this emergence profile.
For me, it's always a good idea to try it. So you can push the implant, you can put the implants, you can screw the cylinder on top. You try the drill. If the drill doesn't touch anything, it's not a big deal. But if the drill touches something, maybe you move a little bit to remove
Okay.
remnants.
We have certain questions, and they're really interesting questions. Thank you for that. So Andreas from Mexico, hi, my friend. He's asking how to, and I can answer this question maybe quickly, how to ensure the connection is not changing in the curing process, that it's still fitting. Therefore, especially for the 3D printing, we created also a reamer. So it's not only the connection which has to be fitting, it's also the screw channel which has to be free. Therefore, we created a reamer tool which you can cut out the screw channel and the screw seats of the 3D printed crown and the connection itself. Yeah, some people they are curing with the analog in screw retain. I don't do that. I had never problem that the connection anyhow get mobile or changing or something. So normally this is really working. You have to be careful before curing. The material is not it's very weak. So in this time you have to be careful. But when you cured, for example, the Onyx Taft 2, after it's very tight and it's for temporary use, it's not for final. So it's not a problem at all. That was my answer. Then another question from Fernan. Hi to Colombia, I think. Do you scan for the final prosthetic again? That's a
Always.
question for you.
Yeah,
Always.
always,
Yeah.
because I want to transfer to the lab not only the position of the implant that they already have, but the shape of the soft tissues. So with the immediate implants, you don't have a great soft tissue shape because you have to deal with maybe modifications, tissue augmentation, something like this. After a few months, we have the final tissues, and I want to transfer this to the lab as well.
Yeah, and I think that's a great question. I mean, there's some workflows, and I know some users they really go for the premolars or molars even in an immediate final process. So they use this AI crown for just like a day to keep the tissue in this shape which the AI crown design gave you. And this design you can copy paste more or less for a zirconia crown. So the dental technician can provide you with a zirconia crown in the next day. This is a risky process, but anyways, you can then give a zirconia crown in the same emergence profile just the next day. That's called immediate final. So we can do that things also with this technique. The next question, easy. I don't know where you're from. Do you have to pick an ASC, an angulated screw channel in design? Yes, you have to do
Yes.
that. Exactly. The angulated screw channel is in the AI crown, and this is something. I mean, Federico, he was involved in the developing of that AI crown design, and we improved that every day. And so at the beginning we could only choose straight screw channels, and I think in the next update you can pick an angulated screw channel in the AI crown software. If you wanna, you can also use an exocad or a tree shape software. There you can always choose an angulated screw channel and 3D print an angulated screw channel, but that's what you have to choose exactly in the software. Doesn't matter if it's in the AI crown software or
Yeah.
in the random ones. Yeah.
Is a dedicated screw, angle screw with 2.6 millimeter of diameter, because you have to deal with, the channel. So the screw is ideal. Is perfect.
Yeah. So then what?
Sorry,
Let's
Easy asked what I'm using to plan guides.
exactly. Yeah, that's the next question.
Yeah,
Right.
this is nice because the system is open, so you don't have to ask the system to provide a specific software. You don't have to buy anything new. If you have your own design software, maybe I am using for that type of guide Exoplan. That is the software of guided surgery of Exocad, but you can use MOP, you can use tree shape or something else,
Yeah.
right, Olger? So it's an open system.
Yeah, we are an open system in all on all kinds of planning and also in designing, or also for the design of the grounds. We can use that AI crown, which is really helping. I think for dentists it's really nice to do it directly chair side. But anyways, it's totally that workflow which you described, Federico, is also still completely possible to do the same thing. Instead of sending this STL file to your AI crown, you send it to your dental technician, and your dental technician, or even you have also the possibility to send this to our design service. We also provide a TRI, a design service, which can design you not only single crowns, also full arches, immediate full arches. We have a great team here which creates you an immediate full arch design after you're having the scan and everything done. And we send you back in between 45 minutes, depending on the situation. We send you back a whole full arch design, and you can 3D print that on your 3D printer.
Yeah, my advice, guys, is to have both. So you have to have on your computer the AI crown, because you can solve a lot of cases on natural tooth or implant based. but not forget that you can ask the technician to design something that is too difficult for you, or maybe to the company. It's not a big deal. So
Absolutely.
you can cover more or less the 100% of the scenarios that you have.
Yeah, correct. So I think now we are shortly before 12 o'clock, 1 o'clock in my hemisphere. So I just want to share for 1 minute these slides here. There's a QR code on the right side, and this allows you to sign up for this AI crown design, which we created with Dentbird. And this is really, you can create your account, as Federico explained very clearly. And then you can, from there on, you can design in this AI crown design, not only crowns on a matrix implant, you can also design crowns and inlays, onlays, veneers, and so on with the software. And yeah, there was also the question, can we do full arches in the future? I think, yeah, AI crown will go in this direction, that we are also having these possibilities. That's future music, as we say in German. But so take the chance to take this QR code. And then after this slide, I want to share this happening with you, because we are having this nice intraoral scanner festival lining up. And this is a not a TRI course. It's a course with different companies, and especially it's with DSD, with Christian Coachman, with Digital Smile Design. This is really something I learned so much last year in this festival. It's including the Anini brothers. We have guest speakers, and we can provide you a 20% voucher for this 2 days course. And really, I know a lot about digital dentistry, but here I learned so much in the past. And if you have time, join us, and from the 7th to the 10th of May in beautiful Modena. You see there that little red car. We will be in the Ferrari Museum, and have a lot of nice events besides the presentations and the knowledge we share with you, and different companies from different scanner companies coming and showing their really detailed know-how about digital workflows to the fullest. And so last but not least, because this was the last masterclass with the topic AI crown design. So that was a trilogy, and we have the next trilogy coming up, and this is going in the next chapter here. So I'm really happy to announce this, at least 2 dates already, because we have the next 3 webinars, and there we're going into full arches. So fully digital full arches, especially into the direction FP1, because FP1 is something in combination with the matrix system, as Federico explained so perfectly, this emergence profile polished zirconia without an abutment. Imagine this for FP1 full arch cases, and these 3 masters will be in this masterclass. First, it's Joel Telles on the May 19th. He is a full arch master. He's using TRI many years. I think he will show up 10 years follow-ups on full arch approaches with the TRI system, not with the matrix in the beginning. And then we continue with Stavros Pelikanos, and Stavros, he just made a course in Greece last weekend with the matrix system in his environment there in Athens. And I'm very happy to announce that Julie first, he will do that masterclass for 1 hour. And then at the end, at the final end, we have Dr. Art Mireles. He is from the USA. There we have to wait for the date. That will be in August, September, anytime we will announce that. And with this, I want to say thank you again, Federico, for this really amazing presentation. We will share also the link to the video recording quite soon. Thank you very much.
Thank you, Olger. Thank you, TRI. Thank you, guys, for being with us.
Have a great time. Bye-bye. See you next time. Bye.
Bye-bye.